Hello everyone, I'm Dr. Linda Chu and I am an assistant professor in the Department of Radiology at Johns Hopkins Hospital, and we're going to talk about cinematic rendering, liver and pancreatic applications. So, as you have probably heard from other podcasts, the cinematic rendering uses a global illumination model that takes direct and indirect illumination into account to generate these photorealistic images. And as you can see on the video, you can see very lifelike, realistic appearance of the liver and kidneys and spleen. And as we zoom in, you can see very exquisite vascular detail. You can see all these fine vessels that you normally can't see with the other rendering techniques. And the cinematic rendering has the potential to more accurately depict anatomic detail. When I think about potential applications of cinematic rendering in liver imaging, it has the potential to improve lesion conspicuity, improve lesion characterization, assist treatment planning, and facilitate communication with referring clinicians and patients. So cinematic rendering, because of the different rendering techniques, we can improve the tissue contrast and depth perception. And that can lead us to accentuate very subtle textural changes relative to the background parenchyma. And when you look at this example of a cirrhotic liver in both arterial and venous phase images, with the cinematic rendering, you can really accentuate that surface nodularity of the liver and also the micronodular parenchymal pattern of the cirrhotic liver. And when we look at this case with a patient with hepatitis B and C and hepatocellular carcinoma, you can see that there is this vaguely hypervascular lesion within the right hepatic lobe with very subtle washout on the venous phase images. But when we compare that to the cinematic rendered image, you can see greatly increased contrast to background ratio of this cinematic rendered image, and it really makes the hepatocellular carcinoma pop out compared to just the regular axial images. Another example of a hypervascular liver mass is this example of a focal nodular hyperplasia. You can see this hypervascular mass within the left hepatic lobe, and when you look at it with cinematic rendering, again, you can see it greatly increased contrast compared to the background liver. You can really see nicely appreciate this hypervascular enhancing mass. And as you would expect for focal nodular hyperplasia, it would be iso enhancing relative to the background liver on the venous phase image. And the nice thing about cinematic rendering is that you can alter the background translucency of the liver so that you can make the background liver almost transparent and greatly improve the conspicuity of the liver lesion. And on the movie on the right, I'm showing you how dynamically we can change the window settings and change the background translucency of the liver to really make the lesions pop. And this technique not only works well for hypervascular liver lesions, it also works very well for hypovascular liver lesions, such as this example of a cholangiocarcinoma. So on the regular axial images, you can vaguely see a hypoenhancing mass within the right hepatic lobe that has mild capsular retraction, and it's associated with mild intrahepatic biliary ductal dilatation. But again, when you compare it to the cinematic rendered image, you can greatly increase the contrast between the cholangiocarcinoma relative to the background liver and greatly improve lesion conspicuity. Let's look at this case with the metastatic head and neck squamous cell carcinoma. We can see multiple hypoenhancing lesions throughout the liver. But when you look at the cinematic rendered image, the cinematic rendering technique can really accentuate these subtle textural changes of even the smallest metastases throughout the liver, so it can really improve the lesion conspicuity. And cinematic rendering can accentuate the enhancement pattern and internal architecture of the focal liver masses, and these features are very important in the differential diagnosis of focal liver masses. Let's look at this example of a hepatic hemangioma. On the axial image, you see the classic peripheral puddling of the contrast, but with the cinematic rendering, we see improved depth perception, so you get a better look of these peripheral puddles of contrast. And as you would expect, on the venous face images, you see progressive fill-in of the hepatic hemangioma. And I really like this example of a giant hepatic hemangioma. And when you look at it, you can see these large plumes of contrast all studded along the periphery of the hepatic hemangioma. And as I have shown previously, you can alter the background translucency of the mass so that basically the hemangioma is almost transparent, and all you see are these contrast puddles all studded along the periphery of the mass. And this is another zoomed up look where you can really see these large vascular spaces with these large plumes of contrast, which correlate well with what they would see on pathology. Contrast this case with this next example of a cholangiocarcinoma. So with the cholangiocarcinoma, you see continuous peripheral enhancement, and it's also much more heterogeneous compared to the hemangioma. And when you look at this cholangiocarcinoma, again with the cinematic rendering, you can really appreciate how heterogeneous the lesion is and know that this is a more aggressive lesion rather than a hemangioma. And this technique really accentuates the internal architecture of cystic lesions. So when you look at this cystic lesion within the liver, you can see there are a few internal septations within it. You can see there is some thickening along the periphery of the lesion. But when you look at the cinematic rendering, you can really appreciate those internal septations and peripheral thickening much better compared to the axial image. And these features would lead you to think that it's a more aggressive lesion, which would be consistent with a metastatic GIST tumor rather than a benign cyst. And a great advantage of cinematic rendering is that it can facilitate treatment planning. The improved depth perception can better assess the extent of local tumor invasion. We can identify feeding vessels for local regional therapy, and also provide a global impression of tumor burden, which is helpful in communication with referring clinicians and patients. And when we look at this example here of a liver abscess, on the axial images, we can see that it's multiloculated. There are multiple internal septations. There are many cystic spaces within this abscess. But when we look at the cinematic rendered image, we can appreciate that those multiloculated internal septations much better compared to the axial image. And based on the cinematic rendered images, we would expect that this abscess may be rather difficult to drain because there are many tiny pockets rather than one dominant pocket. And indeed, when they went in to try to aspirate this abscess, they got very little fluid out of it. Another example here with the cinematic rendering, it can accentuate the depth perception so that we can really appreciate how this metastatic colon cancer is invading into the lumen of the gallbladder, and it will help the surgeons visualize the surgeon's visualization and treatment planning. Another way cinematic rendering helps is that we can provide these rather exquisite vascular maps to identify feeding vessels. This is a case with biopsy-proven hepatocellular carcinoma, and we can see these really nice feeding vessels going peripherally to supply this HCC, and that can help for the interventional radiologist to try to identify these feeding vessels ahead of time and help with their treatment planning. Another example here, this patient has metastatic pancreatic neuroendocrine tumor, and we have this large hypervascular mass within the pancreas with multiple enhancing metastases within the pancreas. And again, with the cinematic rendering, we can get the really realistic look of the primary pancreatic tumor and also the multiple hypervascular metastases. And we can follow these hepatic arteries all the way out to the periphery of the mass and really see the vascular supply. And these kind of vascular maps can help with the planning of local regional therapy. And as I mentioned, a lot of what cinematic rendering can do is with communication. This is an example of a woman with widely metastatic cholangiocarcinoma throughout the liver, as you can see on the coronal images. But with the cinematic rendering, we can alter the background translucency of the liver so that in one image, you can really get a global view of just how many mets there are throughout the liver. And this is another rendering, making the liver even more transparent so you can see through the whole volume of liver to appreciate how many mets there are. And I think these more lifelike and realistic depictions can be very helpful in communicating the disease status with patients. And then we will shift focus to talk about the potential role of cinematic rendering in pancreatic imaging. And a lot of the potential applications are similar to liver. But I want to show you this video with the normal anatomy of the pancreas, see how you can really appreciate the lobulated nature of the pancreas, and you can see really lifelike appearance of the spleen, the liver, and both kidneys. And improving lesion conspicuity in pancreatic imaging is critically important because up to 20% of pancreatic adenocarcinoma can be isoattenuating relative to the background pancreas. Cinematic rendering accentuates focal textural changes and may improve conspicuity of subtle cases of pancreatic cancer. And when we look at this example here of a rather subtle pancreatic adenocarcinoma, you can vaguely see that there is a hypoenhancing mass within the body of the pancreas, and there is mild dilatation of the pancreatic duct. But when you look at the same case with cinematic rendering, you can greatly accentuate the focal textural change of the pancreatic tumor relative to the background pancreas, making the lesion much more obvious. Cinematic rendering can also accentuate the global atrophy that you would see in the body and tail, a secondary clue that points to an abnormality right in the body of the pancreas. On the coronal image, I'm also showing you how the cinematic rendering can really accentuate the focal textural change of the pancreatic body mass compared to the head. This is another example of a subtle pancreatic adenocarcinoma in which we have this rather subtle hypoenhancing mass in the body again. And again, with the cinematic rendering, we can accentuate the focal textural change in the pancreatic body. And with the coronal view, again, the tumor appears much more obvious on the cinematic rendered image compared to the regular axial image. And this technique not only works well for hypovascular pancreatic masses, it also works well for hypervascular pancreatic masses, such as this pancreatic neuroendocrine tumor. You can see on the axial image that there is this bright hypervascular mass in the pancreatic body-tail junction. But if you scroll through it quickly, you may mistake it for a vascular aneurysm or just miss it altogether. But when you look at the cinematic rendered image, with the increased depth perception and the photorealism, you can really make this lesion pop against the background pancreas and greatly improve the lesion conspicuity. Another feature that is nice with cinematic rendering is with the improved depth perception, we can increase the appreciation of internal septations and mural nodularity, and these features are key in the differentiation of pancreatic cystic masses. And when we look at this example of a pancreatic serous cystadenoma, we can see this large cystic mass within the pancreatic head with numerous internal septations and microcystic changes consistent with the pancreatic serous cystadenoma. But when we look at the cinematic rendered image, we can really appreciate that spongiform appearance of the pancreatic serous cystadenoma, which is classic for this type of tumor. And when we overlay the vascular map on top of the tumor, we can also appreciate how the vessels are stretched along the periphery of this tumor rather than being invaded or occluded by the tumor. And these vascular features of being just gently pushed away is also supportive of this being a benign process rather than a malignant process. And when we look at this other example of a pancreatic cystic mass, in this case is an IPMN, frankly, on the axial images, it can be rather difficult to appreciate the rather thin internal septations. But when we look at the cinematic rendered images with the improved depth perception, we can greatly increase the appreciation of these fine internal septations, leading us to the diagnosis of an IPMN. And when we look at this example of a mucinous cystic neoplasm, again, the internal septations can be rather difficult to appreciate on the axial images. But when we look at the cinematic rendered images of the same case, we can greatly appreciate these internal septations and muronodularity of the cystic neoplasm. And I also like this case of a cystic pancreatic neuroendocrine tumor, in which you can see this hyper-enhancing rim along the periphery of the cystic mass. And when you look at the cinematic rendered image, what you see is a thin enhancing shell along the periphery of the mass, and you can see it quite well against the background pancreas. And when we show these cinematic rendered images at tumor board, the surgeons really love it because they feel like this improved photorealism can really help them imagine what it's like when they open up the patient, and it helps them with treatment planning. And a lot of times with pancreatic surgery these days, it's not a binary decision whether someone is a surgical candidate or unresectable, but there is a lot of gray zone in the borderline resectable category. And having these images can help surgeons decide whether to take some of those more borderline cases to surgery and how they would do any vascular reconstructions. And the cinematic rendering is also helpful in appreciating local tumor recurrence, which can be rather difficult on post-op images. And I'm just going to show you examples of how it shows the local tumor extension. And this is a case of a pancreatic tail adenocarcinoma with direct invasion of the duodenum. And on this coronal images, you can appreciate there is a pancreatic tail mass and it abuts the duodenum. But when you look at the cinematic rendered images, because of the improved depth perception, you can really appreciate how it really extends into the duodenum and invades into the mucosa. Or this example here with an invasive pancreatic adenocarcinoma that's extending from the tail into the splenic hilum. Again, with the cinematic rendering, you get a more three-dimensional look of the disease process, and you can appreciate how the mass is infiltrating from the pancreatic tail into the splenic hilum. And on the coronal view, you can again appreciate this infiltrative mass, and then also how it occludes the splenic vein. And this is another example here with a locally advanced pancreatic adenocarcinoma, and we can see how it's encasing the central mesenteric vessels. The nice thing with the cinematic rendering is we can also show these in movies, and we can turn them around in different angles so that the surgeons can get an appreciation. And we can also fade away the pancreatic tumor and then focus on the vascular map, so the surgeons can now focus their attention on the vascular reconstruction options. And as I have shown before, the tumor encases the celiac artery and the common hepatic artery and splenic artery, and now they can really get a sense of what they need to do to take out this tumor. And this is another example of a locally advanced pancreatic tumor. And again, when we look at the cinematic rendered images, we can fade the tumor out and more focus on the underlying vascular issues. And then we can see this tumor has encased and occluded the portal confluence, and we can see prominent collaterals here, and this can help the surgeons figure out how they're going to reconstruct that portal vein if they decide to take the patient to surgery. And just some still examples. So this is another patient with locally advanced pancreatic adenocarcinoma, and we can see this subtle hypoenhancing mass in the body. And again, on the vascular maps, we can really see how this mass is totally encasing and narrowing the portal SMV confluence. Or this example here of another locally advanced pancreatic adenocarcinoma, we can see how it's encasing the distal celiac artery and the portal SMV confluence. And when we look at the vascular map, we can see how it narrows the distal SMV and common hepatic artery, and how it's encasing and stretching and narrowing the portal SMV confluence. And this is also a nice case of pancreatic neuroendocrine tumor in which you can appreciate that there are prominent feeding vessels all along the periphery of the tumor. But with the cinematic rendering, we can show these type of images that will mimic what the surgeon would see when they open up the patient in the operating room. So there's really no surprises, and then they can make their surgical plans to how to deal with this rather vascular tumor. And as I mentioned before, a lot of times with post-op pancreatic imaging, you always see a little bit of soft tissue stranding in the resection bed, and it can be rather difficult to determine if that's just normal postoperative changes or if it's representative of local tumor recurrence. With cinematic rendering, because we have improved depth perception, it can make the soft tissue recurrence look a little bit fuller, look a little bit more mass-like, and that can help us make the decision. Such as this case here of a patient who had history of Appleby resection, and we see this ill-defined soft tissue in the pancreatic bed. And with the cinematic rendering, we can improve that perception and appreciate that this is a discrete mass rather than the ill-defined postoperative changes that we normally would see. Cinematic rendering currently uses a more complex algorithm than volume rendering and requires higher computational power. Therefore, it requires more powerful workstations and network bandwidths. Each manipulation during the interactive rendering requires a new set of calculations, and it takes longer post-processing time compared to volume rendering. And at the current time, it should be performed in real time and done by the radiologist who knows exactly what the pathology is and how to communicate that to the referring clinicians. Further research is needed to determine whether the photorealism improves diagnostic accuracy and/or outcomes. In the future, we hope to evaluate the role of photorealism and improved anatomic detail in the detection and classification of liver and pancreatic masses, and to evaluate whether the CR vascular maps assist in preoperative planning. In conclusion, cinematic rendering is a recently described post-processing technique that generates photorealistic images from CT datasets. It has the potential to more accurately depict anatomic detail and complex anatomy. Preliminary applications in liver and pancreatic imaging show potential benefits of CR compared to 2D MPR and traditional VR and MIP imaging. These results will require validation in larger studies. Well, thank you very much for watching today. I hope to see you next time. Take care.